Antacids are the most commonly prescribed medication in the US. However, the doctor never explained the patients what are the side effects of antacids. First, protein is always in quaternary structure, which means protein is highly coiled. In this state, the enzymes have no access to the bones. Therefore, it's impossible to digest. When you eat protein, the hydrochloric acid in your stomach is going to uncoil the protein. We call this denaturing the protein and put it linear. Now the protein is linear in primary structure, the enzymes like pepsin can actually break the bones and you can digest the protein. So when you take antacids, you are limiting the amount of protein that you can digest and therefore absorb. And you may feel bloated after eating protein because you cannot digest it. Not only that, it can lead to protein malnutrition if you have a chronic use of antacids. Another role of hydrochloric acid is to kill bacteria and virus that enters with the food. If you take antacids, your risk of infection increases exponentially, especially Helicobacter pylori. Also, hydrochloric acid is needed in order to release intrinsic factor. Intrinsic factor attached to B12 in the intestine and allows the absorption of B12. Therefore, if you take antacids, there is no release of intrinsic factor. Therefore, you cannot absorb B12, which leads to pernicious anemia. Taking antacids is one of the main causes of pernicious anemia. So for all these reasons, you need to talk with your doctor and reconsider the use of antacids and try to look for a natural treatment that doesn't involve the use of drugs. If you want a consultation with me, you can book it in my website, joelexhibio.com. You can pay with a credit card or with PayPal and pick your date and time of consultation. See you next week.